is in the genetics modules, Module 1, Lecture 8, Pedigree Analysis in the Healthcare Setting. We're going to be discussing how to construct and analyze a family history using pedigree analysis. A square is a male. A circle is a female. When the gender is unspecified, we use a diamond. This can also be used in a pregnancy, and in that case we put a P in the middle to indicate that an individual is pregnant. When somebody has a pregnancy loss or spontaneous abortion, this is indicated as a diamond, a triangle. An affected individual, a male, would be a square, and an affected female would be a circle. When an individual is a carrier of a specific disorder, we put a dot in the middle. These either single, vertical and horizontal lines are sometimes used to indicate a certain partially affected or something a little bit unusual that we're trying to document. A line through the individual indicates that that individual is deceased. And when we have a triangle with a line through it, that means it's a termination of pregnancy, not just a spontaneous pregnancy loss. Here we have some additional indications of the symbols. When a male does not have children, there's a line with a dash, and here's a female with a line and a dash. However, and here we have a couple, and this is there are no children by choice, but when there's infertility, there's a double line here. That means they've been trying to have children and not been successful. One of the most important things when putting together a pedigree is to indicate the individual that you're talking about. And sometimes these pedigrees are very large, and so there has to be an arrow by the individual, the consultant, or the proband. Sometimes in a large family, for instance, if we're taking a family history and the father has, let's say, 4 sisters and 5 brothers, if none of them had any specific medical information, that's interested to the pedigree, we may just put there were 4 sisters and 5 brothers. And sometimes we'll be asking a relative and they'll say, oh, I'm not really certain how many siblings my dad had, or I know there's like 8, but I'm not sure how many brothers or sisters, so we might just put a diamond here with the number. Some additional relationship lines. When an individual is married, there's a single line between them. Consanguinity, first or second cousins, we have a double line here. Here we have a couple that's married and a child, that we have the horizontal and the vertical line. And here is an indication of siblings. When there are twins, it's 2 lines coming from the same place. When they're identical twins, in addition to this, there's an additional line here, and this indicates monozygotic twinning. An individual that's adopted in, there is this line, the box that goes in, and if they were adopted out, there would be a box that went out. So continuing on the relationship line, sometimes there's, again, adopted in. Here we have a couple. The woman is pregnant, but the biological father is a donor. Here we have a woman who's pregnant, but the baby is adopted by a relative, or excuse me, not pregnant, but she has a daughter that was adopted by a relative. And here we have a couple who are pregnant, but the woman carrying the pregnancy, the biological donor, it's a donor egg. And here finally we have some other unusual situations where we have a couple who is pregnant using a surrogate, and here we have a couple and there's a donor egg and a pregnancy, so this is a surrogate using her egg and his sperm, and she's carrying the pregnancy. So rules for pedigree construction. The male should always be to the left of the female. The oldest sibling should also be furthest from the left and the youngest to be most to the right. Individuals in the same generation need to be in the same line. So information also collected when doing pedigree analysis and constructing a pedigree includes maternal and paternal ethnicity. For instance, German, English, African American, Hispanic. Certain conditions are more prevalent in certain ethnic groups, and that's why this information is very important. Ashkenazi Jewish ancestry. Individuals of Ashkenazi Jewish descent are basically individuals that are Jewish and their relatives came from Europe. The Ashkenazi Jewish population has a higher prevalence of a number of inherited disorders, and so it can impact carrier testing. If an individual even has one grandparent that's of Ashkenazi Jewish descent, it's important to document that. And often it needs to be asked separately. And then finally is asking consanguinity of the family. And if the answer is yes, we have to document exactly where the consanguinity is. So information to collect from the patient specific to the disease of interest. Maternal or paternal relatives, risk assessment can be altered based on the disease on the side of the family or both. For instance, if one paternal aunt with breast cancer and one maternal aunt with breast cancer is not as concerning as if both were maternal aunts with breast cancer. The exact relationship, first cousins versus first cousins once removed. The age of diagnosis of the condition in a family member. For example, breast cancer in a 35-year-old is far more concerning that this could be an inherited disorder as compared to breast cancer in an 80-year-old. And finally, potential other risk factors that might be associated with the disease. If someone has lung cancer, it's important to ask, were they ever a smoker? Or were they exposed to certain chemicals? When the answer is yes, then that may indicate why they developed this disease, and when it's no, it may be more of a concern that this could be something inherited. Information to collect from the patient specific to the disease of interest is the specific symptoms at presentation, the type of treatments and management, and this may give you a clue to the presentation as well as information to know about more specifics. And finally, after the pedigree is obtained, ask some additional questions. Intellectual disability in the family. Is there anyone with learning disabilities? Anyone in the family with 3 or more pregnancy losses? Pregnancy losses are common. About 50% of all pregnancies are lost. But when a couple is having 3 or more pregnancy losses, it is a concerning factor toward if there's a reason for that. Anybody born with birth defects? Depends on the setting that you're in, and it's important in prenatal and reproductive systems. There are certain questions that we may not use as much in different healthcare settings. So here we have a pedigree of a family. The other things that are important is the age of death. So here in our first generation, we have this individual died at 67 from an MI. He had hypertension, DM means diabetes, and a history of alcohol use. And then the grandmother died at age 74 of what's termed old age. They were of Italian, Irish, and Polish descent. This couple had 2 children and 3 pregnancy losses. The 28-year-old is alive and well, and it's currently pregnant. This other child has 3 children, an 11-year-old with ADHD, a 7-year-old alive and well, and a 2-year-old, which is actually the proband because there's an arrow here, with a cleft lip and palate. The mother of this child has a brother and a sister. Her father is alive at age 83 with hypertension and rheumatoid arthritis, and the mother is deceased at age 45 from leukemia, diagnosed at age 44. This mother has two siblings. Her sister has no children, and the brother has a child with cystic fibrosis. Because this child has cystic fibrosis and it's inherited as a recessive, he is an obligate carrier. So this is a relatively large family history in many generations. So here's another example of putting these on the right lines. So in our first generation is known as 1. These individuals are deceased. This sister has 3 children. One of her daughters has a recessive disorder. Because she has a recessive disorder, she has 3 children, and she gave their non-functioning, at least 1 copy. She has 2 copies of all of her genes, and each of her children received 1 non-functional copy, and since they're not affected, you would assume they inherited a normal copy from their father. This daughter has 4 children, a son, 2 daughters, and another son, and these 2 daughters come from the same line, therefore they are fraternal twins. They are not identical because there's not this extra line. Going back up to generation 2, this son married the daughter of his mother's sister. This is a consanguineous marriage, which is indicated by 2 lines. They have 3 children. Their daughter is 8 weeks pregnant. Another daughter is deceased, but it doesn't say why. And here we have a son that has 2 sons and a daughter. This son, however, was adopted in. So, first cousins that are married to each other are indicated by generation 2, 4, and 2, 5. So here we have generation 2, 4, and 5. Individual 4, 5 was adopted into the family. So here we have generation 4, 5 adopted in. Individual 2, 4, 2 and 4, 3 are dizygotic twins. So 4, 2 and 4, 3, and again they're not monozygotic because there's not that extra line. Individuals 1, 1, 1, 2, 1, 3, 1, 4, and 3, 6 are all deceased. And again, when there's a line through them, they are deceased. Individuals 1, 1, 1, 2, 2, 3, 3, 2, 3, 3, 3, 4 are all carriers of an unspecified recessive disorder. So here we have 1, 1, 1, 2, 2, 3, 3, 2, 3, 3, and 3, 4. Individual 2, 3 is affected with the recessive disorder. So 2, 3. And individual 3, 5 had a spontaneous pregnancy loss at 8 weeks. So the benefit of pedigree analysis is it allows quick visualization of the family, including both social and family history, helps to identify potential inheritance patterns, and you can see a full picture of the family history. It's quicker and more informative than textual family histories and can pick up far more things. So how can the pedigree be used? Well, you can look for potential risks for family members and or proband to an inherited disorder to develop, determine reproductive risks, help in making a diagnosis, aid in determining most appropriate testing strategies, distinguish between genetic and other risk factors, determine appropriate medical management and surveillance. It's very helpful in patient education as well as interaction and rapport. It helps the patient feel as if they're part of the whole system. So in summary, appropriate pedigree nomenclature is necessary to ensure information can be universally interpreted. It's important to understand how to construct a 3-generation pedigree. It's helpful in finding pertinent medical information. Example, the age of diagnosis of a disorder, the symptoms or risk factors, other factors that may contribute to the symptoms, such as smoking with certain types of cancer. Pedigrees are a good tool to lay out a medical history as well as the exact relationship between family members. It allows the healthcare provider to provide more thorough and accurate assessment of their patient and provide more information in family history. So we have some questions here from the pedigree. In generation 2, what is the relationship between individuals 4 and 5? In generation 4, what is the relationship between individuals 2 and 3? And in generation 3, what does the circle at the dot in the middle of the circle indicate? So, in generation 2, what is the relationship between 4 and 5? They are first cousins. Her mother and his mother are sisters. In generation 4, what is the relationship between individuals 2 and 3? These individuals are twins. They are fraternal twins. There's no line in the middle. If 2 individuals are different sexes, they have to be fraternal twins. If they're the same sex, they could still be fraternal twins. Identical twins is indicated by the single line. In generation 3, what does it mean to have the dot in the middle? That means this individual is a carrier of a recessive disorder. This concludes Lecture 8, Module 1 in the genetics section for pedigree analysis.